President Trump and the FDA announcing emergency authorization for the use of convalescent plasma to treat COVID-19. The U.S. currently is the most affected country with more than 5.7 million cases and more than 176,000 deaths blamed on COVID. Health and Human Services Secretary Azar with me now. Sir, thanks for being here today, member of the task force, and appreciate you being on.
Glad to be with you, Bill. Thanks for having me.
The inference is that the FDA was playing politics. Was that the case?
Well, what President Trump is demanding is that we all cut any bureaucratic red tape out of the way, because he's demanding we get therapies and vaccines to the American people as soon as they meet FDA's safety and efficacy and regulatory standards. And you know, that's what happened yesterday. Is the FDA granted emergency authorization to use the plasma that comes from people who've recovered from COVID, because it shows a significant benefit in terms of the severity of disease as well as mortality.
Okay, Scott Gottlieb ran the FDA. Here's what he sent out earlier today. He said plasma may provide a benefit. It could be meaningful for certain patients, but we need more evidence to prove it. The data FDA had supports an authorization for emergency use where the standard is may be effective, but we need better studies to confirm preliminary findings. What about that judgment? And is it possible this is not ready for prime time?
Oh, no. So convalescent plasma has been used for 118 years. It was used in the 1918 flu. It was used for SARS, used for MERS. The data has shown it's been safe. Over 70,000 Americans have benefited from plasma as a result of the President's Right to Try initiative. And that's the data that we had, that the FDA based its determination on. Now, again, it's an emergency authorization, so it's based on that data. We're still running the full normal clinical trials on it that could support a permanent licensure of it. But thanks to President Trump, we actually now have data on plasma, which no one's ever had before. It's just been used in medical practice.
Well, if you feel that way, what held the FDA back then? Why were they not giving it the green light?
We were continuing to gather and analyze the data. What we wanted to be able to show, looking at the data, was that there was what we call a dose response. That means the more concentrated the antibodies that somebody had in their plasma, the better the response you would see. And that's what the data indicated at a statistically significant level, was the higher antibody content in people under age 80 who were not yet on mechanical respiration and administered within 3 days of hospitalization saw the greatest benefit.
Okay, so there wasn't politics at work here then? Is that
not at all? Not at all. Not at all. FDA is going to call these balls and strikes straight based on science, evidence, and their regulatory standards. That's what the President expects of them, but he also expects no bureaucratic red tape that's unnecessary.
Okay, another thing from Health and Human Services, this program will allow health plans to contact recovered patients who had COVID-19 for a plasma donation. Does that mean they go through their health care, through HHS to the health care plan? You might get a phone call or an email suggesting or requesting you to donate plasma?
Yeah, so what we're doing is authorizing the contact with people who have recovered from COVID to say, would you consider donating? And I'd ask all of your viewers, if you've recovered from COVID-19, go to coronavirus.gov and you can find information there on how to donate, or contact the American Red Cross or your local blood bank. You literally could save a life from that donation.
If you're that concerned about it, that would suggest some desperation. Do you need this healthy of a supply?
Well, we need people to donate because we have a good number of people that are infected. We have individuals who are hospitalized, and so we need people who have had COVID recently to come in and donate plasma. It's somewhat similar to what you would do for donating blood. It's donating plasma. And we encourage people, please step up and do that. You could save a life.
It is a blood drive of a different sort. Sir, thank you so much for your time. Azar, it's good to see you again, and we hope for progress on this. As always, thanks.